Today we have a very special guest speaker, and this is for all my PAs out there. We have Carlos, so everyone, welcome Carlos. We have a really fun meeting today, and you can get all your questions answered about PA related, but obviously first we're going to learn more about Carlos. And before we begin, we're going to start off with a couple disclaimer slides and informational slides. So let's get started.
Okay, so first and foremost, we just want to get this out of the way really quickly. Just a general reminder, please be sure to respect officers as well as guest speakers during the meeting, such as muting yourself while the host is speaking, using appropriate language in the chat, or if you're speaking. By also reminder to be polite, and also try not to ask any diagnostic questions. We want to respect the guest speaker, and today it is Carlos. Just so they can mostly focus on providing you with, their journey without feeling uncomfortable. Like Shania said last year, unfortunately, if somebody do not follow these rules, we will have to somebody has to cast their wrath and remove you from the meeting. So please try to follow these rules. Just a reminder also, the meeting is going to be recorded and will be posted on a YouTube channel. It will be paused when Carlos does show his case study slides, but the questions or the general slides itself will be recorded if you would like to refer to them later. And if you do have any questions and would not like to be on YouTube, feel free to save your questions later, or you can also save in the chat.
Like to earn your attendance point for the meeting, be sure to sign out on the Google form at the end of the meeting with the word of the day, which we will leave in the chat. And if you can't attend the meeting live, you have 24 hours to complete the Google form from the time that we publish it onto YouTube. And then next slide, we'll explain extra credit.
So like Natalia said, you get a point for answering the word of the day on the Google form after every meeting, but there are extra credit opportunities, and this year we added the Kahoot option. When we're in the last 30 minutes or 15 minutes of our meeting, we will play a Kahoot, and the top 3 players will earn 1 extra credit point. And there's also a community service option. So if you do any of the volunteer opportunities on our spreadsheet, you can send us an email and you can get an extra credit point. And the person with the most points gets a gift card of their choice at the end of the quarter.
All right, so here are MOA upcoming events. So on February 18th, we're gonna be hosting an Allied Health panel, and we'll be inviting panelists to talk about the health and medical programs at the Ensign Foothill. And on March 4th, we're going to have a Guided Pathways event, which is hosted by the Health and Life Sciences Village. And there will be counselors talking about how to find internships and opportunities, things like that. And on March 11th, we're going to have a guest speaker event, and we'll be inviting Jacqueline Doe as our guest speaker because she's a medical student. So yes, we have a lot of upcoming events. So make sure to look out for updates through our email and social media.
If you guys are interested in getting involved or interested in any opportunities, we have a spreadsheet created that has opportunities including of volunteering, scholarships, conferences, programs, internships. So it's a great way to, it's a great resource to look at. So if you guys scan the QR code, it'll take you right to the spreadsheet. So I'll give that like 10 seconds in case you want to scan. But if not, I believe we also have it linked to our link tree. Yes, yes. Sure, okay.
So here are our social media and link tree, and make sure to check them out. And it's really important that you're part of our emailing list because we mostly send out updates through email. So yeah, get connected with us.
And now to welcome Carlos. Okay, let's get started.
Well, hi everybody. Thank you all for having me. My name's Carlos. Last name Jaramillo. As PAs, we usually go by first name, so everybody's welcome to call me Carlos. I've been a PA since 2009, 2010. And here, as you can see, according to the first slide, it is still one of the top 10, top 5, fluctuates between 1, 2, and 3 jobs in the US. It's got great benefits, it's excellent cost versus return on your investment. And I meet a lot of very, very happy PAs. I haven't met any unhappy PAs yet, whether it be a PA student or somebody who's been practicing. So it always makes me smile when I see people who are interested in PA, because I didn't know much about it when I first got started. So let's see here, next. Perfect. A little bit of background for me. I was in the Bay Area. I was a graduate of Fremont High in Sunnyvale, and I got into UC Davis. I've been a Bay Area native my whole life. I lived in Davis for a little while. Let's see here. Sorry, I'm just catching up with my own slides.
I'm sorry, Carlos.
No, that's okay. No, because I don't have it memorized. Sorry. No, this last year, no, I did become a dad. I'm an old gamer, still a gamer whenever I can. I mean, it's an excellent outlet for me. I've been running, less so with the pandemic, but I've done half marathons and triathlons, marathons, and I did, speaking of being here to visit my sister on the East Coast, we did an ultra marathon, which is, I think it was 35 or 36 miles a couple years ago. It was great. Next slide. Let's see here. Perfect. So in terms of undergrad, I applied to a couple different University Californias, and I got into UC Davis, and I majored initially in genetics because that was a big interesting thing at the time. I was super excited until I got to the end of my course, because I figured out that I was going to spend my last year pretty much counting fruit flies the whole time. So I didn't find that particularly interesting, and I changed to microbiology, which is a lot more practical and a lot more interesting. I did minor in philosophy because I thought it was interesting, and I also thought it would make me a diverse medical school applicant, because that was my pre-med path. Was when I was at UC Davis, I had plans to go into formal medical school. I got my EMT license as a means by which to get paid to work and volunteer, because they had a lot of unpaid volunteer and a lot of unpaid internships. I guarantee you there's always an opportunity to do something to get experience that involves getting paid, so keep that in mind. Getting paid in experience is okay for a short time, but don't let anybody take advantage of you long term, saying it's an excellent opportunity for you to work yourself into the ground. After undergrad, I worked in EMS just to kind of set myself up. I was, finishing undergrad, and, it takes time and money to kind of set yourself up for the next step professionally. MCAT is expensive, prep course is expensive, financial aid stops. So I took a job in a couple different things and started looking at what the next step was going to be. I looked at being a travel nurse. The programs were excellent, but they were waitlisted for like 3 or 4 years, and some of them were even on lottery, so there was no guarantee you'd get in after 3 years. You just got one more ticket in the box of the lottery. There was a career fair that was at UC Davis, and they asked if I had a degree in microbiology, and it was the FBI, so I applied to the FBI. That was kind of cool. It was one of the most interesting interviews I've ever had, in an unmarked building where they told me exactly what to wear. It was pretty interesting. I also applied to PA school because a good friend of mine on the same path that I had, being an EMT and a firefighter before graduating, decided to do a PA program. She said it was an excellent opportunity to have a license to practice medicine, and it kind of built on what we had already done as undergraduates with all of our education and all of our clinical experience without having to start all the way over. And the pathway was 2 years. 2 years to a license to practice medicine. So I found that really appealing. So that's what it is that I decided to do. I applied to PA school at UC Davis and Stanford. I was lucky enough at that time to get interviews at both of them. Lucky because it was my first time applying, and also because they were both schools that were off cycle. I gave my FBI coordinator a heads up and said I had gotten into PA school and that I was going to be moving in that direction. So that's how I ended up in PA school, and I accepted the PA school for class of 2010 at Stanford. And I started my path as a PA then. I had a lot of experience before that. You can go ahead, next slide. There's a couple of pictures of me and what I did in my former life. I was a firefighter for the U.S. Forest Service as well as an EMT. It was a great experience. I really enjoyed my time. The injury rate, however, is about 80%, and the fires just keep getting bigger every single year. So my wife is not particularly thrilled about that. So I decided to make a change. I had honestly been inclined to be more on the medical aspect of it than the firefighter part of it, but I got a lot of great experience, and I actually got to be paid to be an EMT and a firefighter as opposed to an unpaid intern or an unpaid volunteer at the hospital. So I leveraged the skill set that I had into a position that actually allowed me to be paid and to gain experience at the same time. So it's worth the effort to take some time and to look at finding a way to find kind of an opportunity that also is beneficial for you in terms of financial opportunity and not just completely volunteering all of your time. So keep that in mind. There's a couple pictures of me with my old crew in the upper left. If you didn't know, for the locals in the Bay Area, Paramount's Great America has an EMS staff in-house. So there's about 4 or 5 EMT paramedics and an ambulance in the park, and we respond to calls in the park for all the medical emergencies inside the park. Upper right is one of the groups I worked with teaching EMT classes. On the bottom left is in the East Bay and Vallejo, and motor vehicle accident. And on the lower right is the BART train. There's lots of emergencies on the BART train. Pre-PA, I was at UC Davis and Stanford for applications. I decided to do PA school because it was an excellent opportunity to use what it is that I had already paid for, and that was very important. I'd already paid for all the courses and the classes in my undergraduate degree. At that time, it was an accelerated program. They required a lot more clinical experience, which has since changed. It's a longer program, but a much lower bar for clinical experience. I think it's around 500 hours now. When I applied, it was about 2,000 to 3,000 hours to be competitive, but that was to offset how short the program was. Currently, it's about 3 years and it's a full master's program. I graduated PA school and I worked at Valley Medical Center, the county hospital in Santa Clara. I was very happy there. I did 7 years there before moving on to a different hospital. I worked at O'Connor for a little bit, and then I also was in, currently I'm in Kaiser. And one of the nice things about being a PA, and this is one of the most appealing aspects of it to me, was the flexibility. So I now can work wherever I want at the same time. So I have a job in the emergency department at Kaiser Santa Clara that pays my benefits and my main salary. And I have a per diem gig at Sutter in Fremont that is an urgent care job that I do when they need extra help. And it's an excellent rate. And because I don't have a benefits plan through them, my hourly rate is pretty high. And I get to work both sides of the coin. I can also work in multiple specialties at the same time. One of my colleagues in the emergency department, he is credentialed for the emergency department, for orthopedics, and for plastic surgery. So it's great. Yeah, no joke. I'm not shy about telling you how much I make. You're welcome to ask at the end. All right, so my schedule as an ERPA, for Kaiser, I work 3 12-hour shifts, sometimes 4, depending if somebody else is on vacation, but we kind of flex back and forth to each other when one of us goes on vacation. In my department at Kaiser, there's 6 PAs. And like I had mentioned, it's great because our options are highly varied. I can work at different places, at different specialties, and at different times. It's super helpful because of the fact that with a kind of a non-traditional schedule, I am able to travel during lots of off, peak times, hotel rates during the middle of the week, flights, during non-traditional times. It makes it really great. And I didn't have to have a residency, which was great. As you can see here on the bottom, I got married in Fiji instead while my friends were in residency, scrambling and hustling and flying back and forth coast to coast, spending lots of money on maybes, which was always stressful for me. The whole maybe aspect of it, to go 4 years through and then still have to apply. It's crazy. So it was a little bit more secure for me. And, PA is not the end of the path. You can continue going on with your professional credentials as far as you'd like. You can still go to MD school. It does make you a better applicant with more experience. And a good friend of mine who I was a PA with at Valley Medical Center in the ER for 6 or 7 years, he applied to a bridge program in Pennsylvania where you can go from PA to DO. And what they do is they bridge you and they just wipe 2 years of medical school. And you start in with the second and third year medical students, and you graduate and you apply for a US-based residency as a DO, which is an excellent path to becoming a practicing doctor. Let's see here, the learning curve, university, you kind of had the choice of taking breaks when you wanted to. The learning curve for PA school was a little bit steeper. I will say, however, that has definitely gotten better in my conversations with PA students that I precept in the hospital. With the programs being a little bit longer, there's a little bit less of a steep learning curve. There's breaks, there's better rotations, there's more interaction. Not to say that it was bad during my time, but it was just very rushed at the time that I was able to do mine. The downside to having a little bit longer program is it does cost more in tuition. But there are many programs throughout the United States, coast to coast, that have different versions of PA school. And I would definitely have they're not all the same. Definitely look at different options. Some of them have different strengths, different programs, different styles, different lengths, and they almost all have slightly different preferences for their population that they're looking at it. How to develop good study habits now: take breaks. It's one of those things that I think when your cup is full, it's hard to put anything else in there because it just overflows. So take like a hard break, get a snack, go for a walk. I used to do 2 hours on, 1 hour off, 2 hours study, 1 hour's worth of games. So what if you take too many breaks? Well, in an 8-hour day, you can have, let's see here. So 2 hours on, 2 hours off, 2, 4, 6, 8. So in a 12-hour day, 8 hours of studying and 4 hours worth of breaks. And that's pretty good balance. One break every 2 hours and you can get, 8 to 10 to 12 hours of a day done. And that's a good amount of studying. The content difference, I would say it was a lot more practical, which makes it a little bit easier to engage because it's not as abstract as, required physics or, organic chemistry. Yep, absolutely.
Sorry, we're
right
taking the class right now, so we had to mention
for
it.
sure. No, absolutely. And it's a lot less abstract because you're applying what it is that you're learning into real life. So it's very practical. So which makes it easier to study for because it's stuff you want to know. So let's see here. I got my hours for experience in EMS and fire. I would say it's a great program, but low wage and long hours. EMS and fire are difficult jobs. It was a great decision at the time and I love my experience, but if I could recommend doing it again, now that I've seen the different aspects of being a pre-PA, pre-medical student and working in healthcare, you could definitely pursue with an associate's level degree, an ultrasound tech, a radiology tech, an emergency department tech. There's lots of different tech roles that are excellent pay, great schedules, and they leverage what you've got already at your associate's level for a good credential program and a license to do something in that field. And you are working both with patients and with clinicians, and you get perspectives on both of those. So if I were to do it again, that's probably something I would do. I'd love to be an ultrasound tech. It'd be awesome. EMT to paramedic, I found it not as beneficial. The cost is expensive. The stress is a lot more. And, if you're really into being autonomous, for better or for worse, you tend to develop a lot of bad habits when you're on your own by yourself. So, I would say I decided to not invest in that. As an EMT, I was able to get enough hours and experience to take the next step without burning myself out. Let's see here. And yeah, absolutely, there is no rush. Take a gap year, take a cheesy, hilarious job for 6 months and travel a little bit, go places, do things. It makes you a more diverse applicant and an interesting person. If you really think that somebody who's interviewing you for a program wants to hear the same story over and over again from every single applicant, you are very much wrong. Somebody who's had some novel experiences and gone places and done things. And I don't mean that one time they held somebody's foot in a jungle in Guatemala on a medical mission that they paid $3,000 for. Don't pay to go on a medical mission. Find a charity because it's kind of a hustle right now, but we can talk more about that later. No one's judging you. everybody has different strengths, different backgrounds. People who look strong during interview tend, may or may not struggle in different aspects of things like that. And people who are strong academically can be differently very challenged during clinical practice, where you have to, actually touch people. So everybody has their own learning curve. No one cares when you graduated. That's absolutely true. Really, I still don't even know my colleagues and my classmates' graduation dates because nobody really cares. A GPA is really just a hoop that you jump through. Honestly, I haven't heard the words GPA outside of conversations academically in terms of applying for programs. Nobody cares. When you get your license to practice and where you are, it really doesn't matter where you started, it's where you finish. And work-life balance is extremely important. And that's one of the appealing things. I feel like I have an excellent work-life balance as a PA, because I can flex up or down in terms of how much it is that I work and what it is that I want to do and where it is that I do it. I see a lot of people who are, halfway into their medical career and they're already burnt and they haven't even finished residency yet. So it can be really challenging depending on what specialty or what aspect or what role you choose. If you do decide to go into something in medicine. And I tell all my students all the time, the medicine hasn't changed. The human body still functions in grossly the same way as it did, 15, 20, 30 years ago. We have a little bit more insight. So the medicine is about the same, but where you do it and the people you do it with makes all the difference in terms of quality of life. So if you feel, like what it is that you're doing is not working out for you, it may just be that you need a change of scenery.
I had a quick question about like the work-life balance. So in the previous slide, I know there's a lot of flexibility with like where you're working, but in terms of like the amount of shifts you have per week, do you ever feel burnt out from longer shifts, or do you feel that the, I guess, extra days off and like being able to travel kind of compensate for that?
I would say it's exactly that. I would say with 3 on and 4 off, you definitely have one day to decompress fully, where you just kind of lay down and watch TV or hang out and relax. And then you have the other days to kind of be active and think about what you want to do. I would say it really is kind of one of those things you don't really recognize as important early on in your career, because everybody's on the grind and everybody's trying to, be as competitive as they can. But, that should be something that is not the long-term plan. A 12-hour shift, for some people, they look at that and go, oh my God, that's such a long day. Well, honestly, for me, it is. I do have a break in the middle of it at the 6-hour mark, and it's a 1-hour break, and I leave the hospital. I go eat somewhere, or I go sleep in my car or relax or something like that, just to kind of decompress. But a 12-hour day, honestly, for me, a day at work is a day at work. If it's a day at work, it's already ruined. So whether it's 8, 10, or 12, it's the same kind of thing for me. But for some people, that's a little bit different. If I were to work a traditional 8-hour schedule, I'd have to work 5 days in the week to make the same hours.
Okay, now we're gonna open this
Go ahead, Julie.
we're gonna open this up to a Q&A session. So if you guys want to unmute your mics and ask questions, or if you want to type them in the chat and we can voice them over, feel
Thank
free.
So I have a question. Well, if anybody else is typing in chat. So currently, I'm sure more of us, I'm a 3rd year right now. So I'm thinking about PA a lot more than like a year ago, because, you're getting ready. Did you happen to take like the GRE or PA? There's like this new PA CAT test going on. And
Go ahead.
Did you take it? And
it depends on the program. No, I'm an old man. So it was an option that you could take it if you really wanted to flex that much, and you didn't have to. It was like, if you wanted to submit GRE scores, and you could. Nobody was really asking for the MCAT aside from one program that I was familiar with, and it was either GRE or MCAT, and it was USC, I think, was where they were asking for those types of things. So unfortunately, with the onset of new screening tests, it's really just all that they are. I would say kind of find whatever it is, do a little research on whatever it is that may be something that plays to your strengths, whether it's the GRE, the MCAT, or the new whatever PA CAT that it is. I mean, in terms of looking at way back, I had the choice of taking the SAT or the ACT. ACT had a science section. I rocked it because that was one of my strengths. So I used my ACT scores in getting into undergrad instead of my SAT scores. So kind of do a little time and see what it is that suits your situation the best. You kind of want to highlight your strengths.
That's a really good point. Thank you. Oh, Isabel has a question.
Yes.
Yeah. Hi, Carlos. So,
Hi.
how much do you make? Why don't you flex
How
on
much
us a
do I
little bit?
Yeah, hourly or yearly?
Both, because your Kaiser is yearly, right? And then you
Yeah.
go by hourly for your Sutter Health one.
Yes. So Kaiser, with my benefits package, I make $96 an hour. For Sutter with no benefits package, I make $108 an hour.
And it beats my $15 an hour. It's pretty good. Okay.
And the yearly fluctuates depending on how much I choose to work, because that's really nice to be in charge of your schedule a little bit. So I can make a lot or I can make a little. So, you know, I couldn't tell you exactly what the last year was because I haven't done my taxes yet, but it's usually around 160, 180. Okay.
Okay. Thank you for sharing that and being totally transparent. We appreciate it.
Well, if you're looking at a position that allows you to make money like that for a master's, that's important. That's why it's one of the biggest jobs in the US, is because of the fact that the money that you put in, you're going to get back out. And it varies based on specialty. And I work in a slightly higher paid specialty, but there are opportunities to really recover your investment in a real way, as opposed to a lot of the really long-term professional pathways like medical school or veterinary school, where you're paying on your loans for 10 years, 15 years, and things like that. You graduate with 125K, you know, in debt. So
Wait,
Yeah.
quick follow-up question. So was that your starting like salary as well, or like hourly
that was
wage?
not my
Or
starting salary. I started at about $65, $75 an hour. Good question.
65.
so is it easy to get raises, you think, or that just depends on the department you're working in or specialty?
I would say it is easy to get raises, because as a new grad, they tend to do what they do for every industry, which is lowball you. But once you've actually performed and they can see your capabilities, then it tends to go up from there. And just with the way the cost of living is, and as things go up, especially in California, and you move from different facilities, you know, working at Kaiser is, you know, a more profitable place. So they're a little bit more liberal with their pay. Santa Clara is a county hospital, and it can be a little bit difficult to have a lot of people on staff because their pay is a little bit less. It depends on what you're looking for. I found the experience at VMC really valuable, and I would love to still be working there, even though it would be less. So here's quality of life. So I don't mind Kaiser, but it's not as interesting. I found Valley a lot more challenging. The patients are more difficult, but also very rewarding. The politics of working at different hospitals is complicated, but essentially at Kaiser, I work for Kaiser. I work for the Kaiser Permanente Medical Group. There's no job instability. I work for the hospital. At Valley, they contract out some of their specialties, and one of the specialties they contract out is emergency medicine. So every 2 or 3 years, there's a contract negotiation, and whether or not your medical group gets the contract is up in the air. So after 2 or 3 years of contract renegotiation, or 2 or 3 times of contract renegotiation, the contract for the company that I was with didn't get renewed. It got underbid by another group, and I could, you know, start a new job with a whole new different employer at a different rate with different benefits and different hours, or I could try to stay with my medical group and relocate to a different hospital that was still under their network, or I could kind of lean into something that had a little bit more stability. And that's what I chose to do. It just happened to come with a pay increase, but it's a little bit more boring. Now, instead of working at a major trauma center, I do work at Kaiser, where it's in between Google, Facebook, and Apple. So it can be a little boring with, you know, slips, trips, bumps, and bruises, and I hurt my finger 2 days ago kind of stuff. But that's why I moonlight at Sutter Urgent Care, where I can see my chest pain, my weak and dizzy, my shortness of breath, my heart attacks, my strokes. So I keep my skill set broad.
Next, Natalia asks, would you recommend applying for an accelerated PA program?
It depends on where you are in your life. If you're able to kind of, take a step back and really focus on the program without having any financial complications, any family complications or anything like that, then I didn't have any problem with it. But they were very clear in the beginning of it. They said, say goodbye to your family for the next 18 months. You're really going to be just focused on this program. And you need to make sure that, you're kind of in a financial state to make sure that you're able to finish the program. Because you don't want to be in a situation where you just come up dry and you need, your last quarter for graduation or something like that. So that's why I've never really felt bad when somebody doesn't get in on the first application, because it's just a little bit more time to stack cash and kind of set yourself up for a position where you have less to worry about. Class sizes are capped. A lot of times it doesn't have anything to do with you not being good enough. It's just there's only so many people they can accept per year. So if you've applied once, go ahead and apply again. If you've applied twice, apply a third time. And, in the meantime, live your life, go places, do things, make money.
Did you
Go ahead. Sorry.
did you only apply to PA school once?
I did, and it was off cycle because it was one of those things that I was late with my applications. So I didn't really find out what the application cycles were, and I did not expect to get in on the first round. And that's not because I'm a rock star student or anything like that. I did not have the best GPA. I had like a 3.2, I think, initially. I struggled a lot in my first year. I graduated from high school where you showed up and you paid attention and you pretty much made A's and B's, to a school where everybody was smart. And I was working full time when I was in high school in my senior year, and I couldn't hang working a full-time job to make ends meet and take 16 to 18 units. So I struggled during my first year. It was very challenging. It was very frustrating. What I ended up having to do was I took one less class a quarter. So instead of 16 to 18 units, I took 12 to 14 units, which allowed me to be able to have a part-time job, enough so that I didn't have to stress about making rent, paying for books, and all your normal day-to-day things. It resulted in me having, I think, 1 quarter or 2 quarters more than the 4-year plan that most people set out for. But I graduated and it worked out. And my grades went immediately up, because I was able to actually focus on my studies.
Okay, thank you for that. Isabel asks, do you know any PAs who do clinical research? What do you know about it?
Yes, there are PAs who are involved in clinical trials, especially here in the Bay Area. There's a lot of biotech and a lot of new pharmaceuticals and a lot of people in the game with that respect. And they do need a lot of clinically trained licensed PAs to do things like physical exams and screenings for clinical trials and such. So there is a very research-driven aspect of it too. So it's not always just bedside clinical medicine. You can be involved in research. You can be involved in the academic side of things as well. I couldn't tell you one specifically, but I do know of a couple of colleagues who did clinical research during or in the middle of their PA career. I'd have to check to give you specific companies and names, but yeah, no, that's definitely a thing.
And then circling back to PA school and like applications, what helped you stand out as an applicant?
I called the program and I asked, what makes me a good applicant? I actually asked the question directly. I said, so I see what the minimum requirement is to be eligible to apply. What is the preferred applicant look like? What are some things that you're looking for your program? And one of the things that they told me was, if you can speak another language, that's great. Bilingual would definitely be somebody that's preferred. Working in underserved populations, having some experience working with underserved populations is definitely, appealing to some programs. Specifically to, at that time, Stanford was anybody who had a strong interest in going into family practice, primary care. So they said, we kind of look at those things. I'm not really sure if they would, be as forthcoming anymore, but it never hurts to ask. Just say, I'm looking at your program and I'm interested and I see the requirements on the website, but what are some of the things the more competitive applicants have brought to the table? What are some things that I could do that you think would be, appealing to your program?
Okay, does anyone else have any other questions they'd like to ask?
I was curious about like the medical missions that you said like it's like a hustle right now or like scam where they may ask you to pay.
Yeah.
It can be. You'll see posters on campuses, and I saw one recently on the Berkeley campus for, kind of like this, $3,000, $4,000, $5,000 for an opportunity to go and do a medical mission in some place. But I don't feel like they're legit. I've talked to people who have come back from them, and yeah, you can say that you went on a medical mission, but like at a lot of cost for you. I mean, like you have to really look at the cost benefit. I mean, if you paid $3,000 to like be in a dirty hostel for 4 or 5 days, to say that you were assisting on some minor procedure or something like that. I mean, there's way better things to spend $3,000 on and way better opportunities. So I wouldn't be so driven, because a lot of the medical students that I work with, it's almost like in their mind they have to do that to be a competitive applicant, and it really isn't the case. And a lot of them have their like lame medical mission story. If you know an organization that you can vet, that people have gone places and done things, and they're not looking for like major cash up front for all the things, and the experiences that they come back with are legitimate and valuable, it'd be worth it. But just like with anything, take it with a grain of salt. Just because you'll see flyers all over the place nowadays for opportunities for clinical experience and shadowing and stuff like that. And that goes to the point where I meant, volunteering your time in exchange for experience is okay up to a point, but don't have anybody working you to the ground for experience. At a certain point, you should be getting out of it more than just experience.
Okay. Thank you for that. In terms of PA school, what was your like favorite rotation aside from what you do now?
Let's see here. My favorite rotation was probably, I liked surgery. I thought it was very interesting. I've been in emergency medicine for 10 years, but I liked surgery. I considered applying for a surgery position when I graduated, but surgery was more of a lifestyle than a job. So you kind of have to give yourself to it for quite some time. I liked how it was very kind of organized and controlled, even though it was very serious work, that everything had its place, and, not like OCD level, but like a lot of things made sense, as opposed to like the hustle and bustle and commotion of the emergency department, where you're just like, for the fourth time, what happened? I'm sorry, what? No, today, what happened today? And in the OR, it's kind of like a choreographed dance. Your scrub nurse hands you something, and you everybody is understanding of the plan and everybody plays their role. And I found it very appealing to be part of like a really cool team, which is different from being in the emergency department, where you're kind of on your own. You're very autonomous. And that kind of goes to the variety in working as a PA, is you can have positions where you are very much a part of a member of a team, where decisions are all made shared. You have a round table about your cases for the day, and you discuss your plan and your operative approach, and who's coming in for clinic and who's getting in for follow-up for what case. And you work really closely with your supervising MD or your attending. Or you're in the emergency department, where you show up and you sit down and you just see what's on the board and who's next.
Okay. And then so shadowing is also like a pretty big part of like this whole experience and heading into PA school and during PA school and whatnot. How do you find shadowing opportunities when it gets so competitive?
It is challenging. It's also very difficult right now during the era of COVID. A lot of the bigger hospitals look at shadowing as kind of a liability, so they don't want to have somebody just wandering around that might touch something, or somebody might touch them. So it's difficult. I've been shut down year after year after year at Kaiser to have a shadow. And every year I ask, and every year they tell me no. They tell me that I can have a student if they're enrolled in a program, because a student who's enrolled in a program comes with insurance. So that's the biggest challenge. So I have told people to reach out to their regular doctor if they have one and say, do you have any PAs in your office? Do you have any PAs that you've worked with in the past that you might be able to put me in touch with? You know, the forums, the internets are always amazing for kind of reaching out and networking and things like that. I've also said, you know, if you're at a, you know, school or at a college, a lot of them have a student health or community health center, and they do a lot of outreach, and they do have clinics in some cases that are staffed by PAs or MDs or nurse practitioners. That may be an option. You know, you can stop by your local clinic and say, hey, do you have any PAs or NPs on staff that I could talk to? Maybe just kind of get their experience. You could put me in touch with them. You just kind of have to put yourself out there a little bit. But again, you shouldn't be, you know, explicitly exchanging all your time and effort for a shadowing position. Make sure shadowing doesn't mean that you're picking up, you know, DoorDash and doing laundry and washing cars.
Okay, sounds good. So definitely keeping your doors open, making connections when you can make them, but definitely don't invest all of your time into it. Kind of.
Yeah, keep your options open. You know, don't pick just one path. And if it's, you know, you should be. I see a lot of people that are really driven, and a lot of people who have a lot of focus and a lot of drive, and think if they just work harder that they're going to get from an organization or from an individual what it is that they need. A classic example is grinding and, you know, trying to get a letter of recommendation from one professor because that's the professor. Just kind of spread yourself out a little bit. Ask lots of different people. You never know who's going to know somebody that might know somebody else. So, you know, don't put all your eggs in one basket, essentially.
Yeah, guys, don't put your eggs all in one basket. Okay. So now we're gonna wrap up Q&A shortly. If you guys have any other questions, continue popping them in the chat. Now we're gonna transition over to the case studies. So whoever's recording, if you want to stop recording now, and then we can.
As well. Okay, so my first question is, it was great looking at your case studies, and it was just very interesting because I recently graduated from an EMT program, and you have to take like the NREMT and everything. And what's most challenging, and I see you do this every day, is that for the first time, I'm required to apply what I learned to real life, and I'm super hesitant to touch a person. And I'm wondering if you have any advice on, like, there's just so much information, there's so much that goes on in the human body and stuff, and you do this on a daily basis. But as a person who's never really done it, like, how do you apply that knowledge? How do you get rid of imposter syndrome? Like, how do you practice and not mess up and like accidentally kill a person, you know?
Well,
like
it comes with time and comfort, but when you're doing it right, you know, it comes with time and experience, and there's absolutely nothing wrong with the imposter syndrome. Sometimes I feel it myself when I have a procedure that I haven't done in a while, or a case that's really complicated, or I have to present something that's very difficult to one of the specialists that I know is mean. So that can be challenging, and that doesn't go away, but you can definitely mitigate that where it's minimal and it's not an everyday or all the time thing. And the way that you do that is just making sure that you're respectful and that you are comfortable and not being put in a position that's awkward or strange for you by either the patient or a coworker, which happens sometimes. There's a lot of peer pressure in medicine. Oh, I do that all the time. It's fine. Oh, you can write that prescription. It's not a big deal. Oh, you can put that needle there. I do it all the time. It's not a big deal. Just kind of do what it is that you think feels right. And, you know, you might catch a little bit of heat for it, but I haven't been sued in 12 years. So, I mean, I may have said I'm not comfortable doing that, or I don't think that's a good idea, but it's kept me clean. And in terms of, like, you know, my practice, I would say it's a very good question. It's a very good question. And I'm trying to reflect back on my EMT days where I had a lot of different, you know, role models and perspectives and inputs, and they were all so different and so varied. In terms of, like, you know, killing somebody, it's extremely unlikely. And if somebody's in a serious medical emergency, I mean, most everything that you do is going to help. If you want to look at a darker joke, I mean, you can't kill them twice. So, I mean, if they're already dead, there's nothing you're going to do that's going to make it worse. That was one of my emergency medicine attendings. So, you know, go ahead and try whatever you think is going to work best in a really critical situation like that. So, and that's why you're trained. You're not a bystander anymore. So you have the experience to be able to kind of step into that shoes. So,
Oh, thank you.
yeah, you're doing fine. You will be fine.
Yeah, I mean, like when I was in school, we had to go on like clinicals, and I was like, oh my God, what am I doing here? Like I was in the back of the jump seat. I was like,
Any new growth is going to be a little uncomfortable. It's a
yeah,
bit of a challenge, you know. So I mean, it's kind of a good nerves. It's kind of like a good anxiety, you know, until you get that solid footing. You know, specifically in emergency medicine, in EMS, in the pre-hospital setting, you know, you have to remember that one of your best tools, one of your primary interventions, is the gas pedal. You're not going to fix everything in the middle of the street. You should just take them to the hospital. And that was kind of a
yeah,
really simple, basic, like, what is this mess? Load and go. Let's just go to the
Look,
hospital.
got it. Yeah. Okay, thanks. Ooh. If anybody else has questions, go ahead.
Okay. We
You
have
can
two
be
more.
about my personal life, my professional life. You can ask my wife a question. She'll come in here.
Okay, we have two more questions in the chat.
Sure.
So Kirsten asks, have you ever felt queasy while performing procedures on gruesome injuries?
Queasy, not because of the nature of the injury, because with training, you kind of look at it kind of a little bit detached. So when I see a terrible injury, it's interesting because you kind of like, I think the term would be like code switching. So I look at it not as like, oh my God, that's terrible. I look at it as, okay, so what am I seeing? What are the layers in this injury? What is it that I need to fix? What is it that I need to consider? What is it I need to manage? What is it I need to medicate? You know, so I'm already formulating a plan. So I had a patient who shot his pinky finger off recently with a handgun on accident. It was stupid. And I'm looking at it and it's just kind of hanging there. And in my mind, I'm thinking, okay, well, you know, pain medicine before, you know, x-ray, you know, probably going to have a conversation with plastic surgery, decide if they want to reimplant the finger or not. I don't think it's salvageable. So that being said, I got to let the patient know X, Y, and Z. I give them IV antibiotics because it's an open wound with bone sticking out of it. And, you know, you go through your process. You go through your process just like an athlete would, just like a musician or an artist would. It's a trade, it's a craft.
And then working in this field, obviously, like death is something that can happen. How do you deal with patient death?
It depends. So I'll be honest with you, there are different opinions and perspectives on patients' deaths. Patients' death is not always a bad thing. You know, there's a lot of people who suffer for a long time with terrible diagnoses, and sometimes, you know, passing on, dying is kind of a release from that. Really sick cancer patients, patients with very poor quality of life. In my perspective, I have very much learned that it's quality over quantity. You know, 6 months, 1 year, good year, happy, functional, mentally there is better than 5 years on a vent where you're just there. Family doesn't have the ability to interact with you. Friends can't interact with you. You don't have any interaction with the rest of the world. A perfect example of that was a couple days ago in the emergency department. There was a lady that was brought in by Uber who was unresponsive in the back of the Uber, and they brought her in, and she was in her 60s, and she had a very serious illness. She had a ruptured aneurysm in her aorta, the major blood vessel coming out of the heart tore, and you can continue to do CPR on that 66-year-old's chest and break bones and put tubes in all the different places. And there may be very little to no brain function at the end of it. And family decided that they would prefer comfort care. They wanted her to be comfortable. And she passed. And everybody was okay with that. Because we do a lot of full code resuscitations on 99-year-old patients who have zero quality of life. It's very bad. It's very bad.
Thank you for that answer. Would we be able to ask your wife a question?
Yeah, absolutely. Hold on. Ready? 1 second. Ready, honey? Can I borrow you? I need you.
Julie went for it.
Wait,
Who is this? The panel wants to ask you a question. Undergrads. Can you still see me?
Yes, we can.
Can you hear this ridiculous child?
Yes, we can.
This is my wife.
Hi, everyone.
Okay. We would like to ask, how does it feel to be married to a PA?
I mean, I think it's like kind of a perfect ideal situation because he's home a lot, especially if you're in the ER and you work 12-hour shifts, then he's home 4 days out of the week, which is great. And I get evenings to myself, so that's also very nice. So, makes good money, takes care of us. So, and isn't in a ton of debt if you were a doctor. I don't know.
Thank you
Does
so
that help?
much.
Yes, of course.
All right. Any other questions for me or the missus?
I swear I had one, but that question threw me off. So.
Thanks, honey.
Okay.
Okay. Bye.
Oh, what games do you play?
What games do I play? I'm a couple years behind because I have to wrangle a little one. So let's see here. The most recent ones that I finished, Hollow Knight was great. I did the Dark Souls series earlier in the year. I'm really having a hard time not having a Switch with all of the Legend of Zelda titles that are out right now. It's very. Let's see here. What else is on deck right now? I have a shooter, Borderlands 3, and then the most recent Star Wars game I just downloaded to try to play at some point. We'll see. But I'm kind of all over the place.
Yeah.
I'm clean and sober from Dota for 4 years now. So if anybody's familiar with that, it's absolutely terrible.
Yeah, most of us know League. I play Genshin Impact now. Don't get
Nice.
it. Yeah, I was just wondering. Someone has a question. Julie, I don't know if you want to go ahead.
Okay. Melanie asks, how was your time at Stanford and how was the process?
In terms of my time at Stanford, I was there for 18 months. The first 6 months were pure didactic. So lectures Monday through Friday, 9 a.m. to 5 p.m. You had the weekend to study. And then on Monday, you took a test for an hour and then the cycle repeated. That was for 6 months. And then for clinicals, you had a kind of always going on clinical in family practice primary care. And then you would bump out for different rotations because they kind of cycled through different rotations with different people at different times. So while you were on your surgical rotation, your classmate would be on emergency medicine, and then they would rotate through. So then when they finished, you would switch. And then if there wasn't a rotation available for you at that time, you would go back to your primary care. It's kind of like they have coordinators, clinical coordinators, and site visitors. They would come to wherever it is that you were rotating, and they would, precept your skills and watch you do your exam and your medical decision making, and they would grade your note and make sure everything was on the up and up. You do have some influence in some cases where you rotate, which was very nice because the clinical coordinators are responsible for getting you your rotation. But if you know a guy or who knows a guy, or if you know a girl who knows a girl that has a really great doc that they work with in a certain specialty, then you can let them know to just send the paperwork to the university and you can rotate with them. A lot of people that I know did that with doctors they had worked in before, because in my class, there was some nurses, some medical assistants and LVNs and all different aspects of pre-PA life. So in my class, there were nurses, 2 foreign medical graduates, firefighters, EMTs, paramedics. There was an acupuncturist, 2 chiropractors, a medical assistant. Yes, I said an acupuncturist. Danny Johnson, he's a good friend of mine. He's great, works in Santa Cruz now. His boss actually helped sponsor part of his time at Stanford, because if he had his PA license, he could also do Western medicine in addition to Eastern medicine. So they have their acupuncture and their holistic practice. And now Danny Johnson has Western training as well. So if somebody comes in with a pneumonia, you can't really acupuncture a pneumonia out. So he can write you a prescription as well. So they use his training for a lot of pain management, non-narcotic based pain management, acupuncture, electrotherapy, and then on the Western medicine side, nerve blocks, joint injections, and a lot of kind of both sides of the coin type approaches. So a lot of different backgrounds and a lot of different paths that you take.
I have a question in regards to like PA school. So I heard that California PA schools are really expensive, and there's a bunch of like out of state PA schools that you could apply to. But I noticed that you applied to like Davis and I believe USC, Stanford. Would you recommend to go out of state if it's like, or would you just say just stick it to here? If what's your input on that?
Absolutely go out of state. Look at it as a life opportunity. There's more than being in the PA program. To be able to live in a different place for a little while, you may realize that may be someplace that you want to practice, or you could always come home after that. It's just a chapter in your story. I know a lot of people that went to PA school in different places. Students that I've had in the past have gone to Duke, they've gone to Western, I just had a student who shoulder tapped me to help her with her interview for Ithaca in New York. They have a PA program there now. There's a new program in Monterey that's in this first few years. So there are newer programs too in California, but there's absolutely nothing wrong with going out of state for sure. Because you have to think about it's your investment, it's your money. So, look at it as a small adventure and apply to different places and see how things are.
Yeah. Would you say like California schools in general is like just really expensive compared to the rest of out of state schools?
You can always find more expensive than California if you look hard enough, because there's some places that really charge a lot of money for the experience, but it's all about the education you get. So the question that I ask when students and applicants are asking me about what about this program, what about that program, and what do you think about this one? At the end of the day, you're paying for your program to give you enough skills to pass your boards, because without passing your boards, you can't get your license. So the question I always tell them to ask when they go for interview and they ask, do you have any questions for the program? You ask, what is your first pass, the boards are called PANTS. So the first pass PANTS rate. How many of your students who graduate pass on the first try? And it should be high. It should be in the 90s, because that means 98, 99% of people who finish the program take their boards and get their license to practice medicine. If they don't have numbers, how do you know how many people pass and get their boards? How many people, because you can pay for an education anywhere. Whether or not it gets you where you need to be is unfortunate. It's not guaranteed. A perfect example are those DeVry schools, where they charge you for a ton of classes and education, but then it doesn't really apply to anything in particular. You could take all sorts of classes. I had a vet tech who was telling me that she took psychology of animals. And I was like, why are you paying for psychology of animals? She's like, it's like a $300 textbook. And it's a class that I have to take. And I was like, really? She's like, yeah. And then at the end of it, it didn't really translate to anything. So if you're spending your money or money you're going to have to pay back, or if you're lucky, your parents' money, make sure you're getting out of it what it is you intend. So making sure that the program that you're looking into, brings it, that they know what they're doing. Because some of them dip a little bit. Samuel Merritt in Oakland had a rough time a couple of years ago. Their pass rates were not great. And that's an expensive program.
That's a really good point. Thank you.
Yeah.
Anybody else have questions? Go ahead.
It looks like we have a question regarding how do you feel about private versus public PA programs? Oh wait, we answered that. Sorry.
It depends on what the outcome is. You know, you might have a nicer coat at a private school. It might be made out of nicer material, but it really comes down to your education when you're paying for it, you know.
I have a question, like, how old were you when you did go to PA school?
I was in my early 20s.
Early
I
20s.
was in my early 20s. So I graduated undergrad when I was 23. I bounced around for a little bit until 25 because I didn't want to be on the ambulances for the rest of my life. And I applied, I think, around 25. Yeah, so mid
25.
20s. Yeah, and then if you look at the spectrum for PA students, it's usually, you know, late 20s, early 30s, you know, because a lot of them have gone places and done things. That's what makes PAs such an awesome opportunity, is because you can typically leverage the experience you had in doing something else towards this. It's not starting all the way over. And that was always the biggest thing one of the biggest things for me with medical school, is that it's another 4 years and then however long residency is after that. And nobody promises you a residency. You could be out of luck and not match for residency years after years in a row. And that's a sad story of a friend of mine I went to undergrad with. He got into his safety school, and it was in the Caribbean, St. George or St. Martin's or St. Mary's or something like that. And he did great, had great scores, excellent student. But when it came time to apply for US-based residencies, he was considered a foreign medical graduate and could not get a residency in anything. He does finance now. That's my worst nightmare, is to spend all that time and money and then never have it end up being, like, it never coming to fruition.
Yeah. Isabel says F in the chat.
Yeah, for real. I don't ask him about it anymore. We're still good friends, but I do not bring it up.
Yeah, that's horrible.
You're a good friend for that.
I'm trying.
Okay. I think now we're going to shift over to our Kahoot. Oh wait, here's the words of the day. It's Pete's. So if Natalia or whoever can put the form in the chat. And thank you so much, Carlos, for sitting here and talking with us today. All the answers you provided were super insightful. Shout out to all the PAs and upcoming PAs. Yeah, thank you so much for an amazing conversation. And you're welcome to stay if you'd like for the Kahoot, but if not, don't feel inclined to. But yeah, thank you so much.
No problem. Thank you guys for having me. It's always a pleasure. I really appreciate it. It's an excellent opportunity for me to give you guys a little insight. And I didn't have anybody to offer any information about what it was to be a PA when I applied. It was it was a very different time. It was a very different time. So
Yeah,
you guys
we
have
appreciate it.
Yeah, you guys have my contact info. Sometimes people don't have questions right off the bat, but if there's follow-up questions and things like that, I'm always open to respond. Let me know. And thank you guys again for having me.
Thank you.
Thanks. Thanks, guys. Don't stress. It gets better.